Healthcare is almost always a top concern for voters. This election, we're also hearing a fair amount about dental care. Currently, it's predominantly a private system, but each of the main parties has put some measure of public coverage into their platforms. What do the professionals who actually deliver such care think about all of this? Well, let's find out. LouAnne Visconti is president of the Ontario Dental Association, and she joins us now to drill into this. We have to have a terrible pun off the top, don't we?
I was going to say, that was great.
We just have to. I mean, that's just the way it goes. Let us take a look. I want to just share with everybody what's now available as a government program to Ontario kids from lower income households. This is the Healthy Smiles program, which people may have heard of. Includes a regular visit to a licensed dentist, covers the cost of treatment, including checkups, cleaning, fillings for a cavity, x-ray, scaling, tooth extraction, urgent or emergency dental care. But cosmetic dentistry, teeth whitening, braces, that's not covered by the program. And just so we're fully up to speed here, is there any government program currently focused on adults as opposed to kids?
There are actually two programs. One is Ontario Works and the other one is Ontario Disability Support Program. And of course we have our Healthy Smiles Ontario, which delivers access to dental care for children and youth under age 17. The one program that we are emphasizing in our advocacy from Ontario Dental Association, Ontario Dentists, is of course the one for Healthy Smiles Ontario. Mm-hmm. We're hoping that by starting with Healthy Smiles Ontario, that we will instill good behaviors and good preventative behaviors in the younger population that will carry through into their adulthood and translate into excellent oral health and therefore excellent overall health.
Let me make sure I get this though. Like Ontario Works is basically welfare, ODSP is if you're disabled and you need support. So if you're in one of those two programs, there is dental services covered by the public that is a part of that.
There are.
There are,
yes.
Okay. And if you're for Healthy Smiles, does the province of Ontario pick up the whole cost or just a piece of it, or how does that work?
So in the past, Ontario's dentists and the Ontario Dental Association were actually the administrators. We created the programs, we administered them, and we treated those less fortunate in our communities. And then in the late 50s, the government began to partner with us, and into the late 90s took over complete administration of the programs. And from that time to the present, the issue is the funding hasn't kept up with the demand.
So they don't pay the full shot of it?
No. Their funding has not kept up with the demand. It doesn't cover the cost to deliver the service.
So dentists basically pick that up out of their own pockets?
Absolutely.
Do you have an idea what percentage the public picks up versus what dentists themselves have to pay?
Well, I know that dentists, the public itself is, they come in, they have a card. The dentist is the one that is reimbursed by the government.
Yeah, I get it, but what percentage would be reimbursed by the government?
So you might be looking at 44% on average.
Reimbursed by the government?
Sometimes it's 22%, sometimes 33%, depending on the procedure.
So Healthy Smiles is very much, we are depending on dentists out of the goodness of their heart to basically pick up more than half the shot on that.
The majority of dentists are treating these patients because we care and because it's the right thing to do. Okay,
LouAnne, you know that unlike in previous election campaigns that I've covered, all four major parties have got something to say about dental care in this election. Let's bring this graphic up and we'll share this with everybody. The NDP's got a $1.2 billion proposal to provide dental care coverage for everyone in the province. It would expand full dental to contract, full, and part-time workers, as well as low-income children and retired seniors living without a pension. So a very broad program. The Liberals announced their program in their 2018 budget. It's $800 million over the first 2 years of the program, and it would introduce a drug and dental program to cover 80% of specific drugs and dental costs. The Tories got into this just the other day, a $98 million annual program, dental care for low-income seniors. A single senior with an income of $19,300 or less, $19,300 or less would qualify, or a couple with a combined income of $32,300 or less would qualify. And the Green Party brought their platform out this morning, and they would implement a universal dental care program. Okay, all four major parties having something to say about a public dental care program. What's your initial reaction to all of this?
Our initial reaction is it's been fantastic that everybody is bringing dental care to the forefront. It shows that our advocacy efforts over the past several decades are finally, kicking in. The one thing, though, to note is that, it's fine to put in a new program and to implement a new program, but our message has been consistent. They have to fund what they currently have. We
Is
have
that a concern of yours?
Absolutely.
So if
before they can go on to creating a new program and embarking on funding for that new program, they have to fix what they already have. We have, as an example, the Healthy Smiles Ontario program. That is a program that is solely dedicated to providing dental care for the children and youth under 17. When you look at the budget announcement and what's coming out, it's combining drug and dental. So to me, although the details are still pretty scant and we would have to analyze the proposal, when you think about it, it's diluting that benefit.
So let me just make sure I got this. You're happy that the four major parties have got something to say on dental care,
Absolutely.
but you don't want them offering new publicly financed dental programs unless they're going to actually fully finance those programs. Have I got that right?
Well, unless they're going to finance the programs that they currently have. If they have programs in place already and they're not funding them properly and sustainably, then what's the commitment going forward in bringing in a new program?
So are okay, you've already told us that the Healthy Smiles program is not fully funded by the province of Ontario. What about for Ontario Works or
It's the same thing.
not fully funded?
It's 46% for Ontario Works.
Okay, so the idea then is if you want to bring in, whoever forms the next government, if you want to bring in a new Dentacare plan, fully fund the thing.
Absolutely.
And maybe while you're at it, fully fund the other ones while you're at it.
Well, fully fund the other ones. I think the starting point is to work with what we already have. We don't have to reinvent the wheel here. We have programs, again, solely dedicated to targeting certain populations that need access to dental care.
Disabled people, younger
Disabled people, younger people that come from
people.
Yes, people
Okay.
that can't afford it. They don't have insurance coverage, and so when you target those, these programs are targeting those people. So why not fund those properly before you can even come up with something new?
Because they want to come up with something new. This is a hot new thing now. You know that, right? Dental care is the hot new thing.
Well, I can say that after years of decades of silence, again, we are very, very excited that access to dental care has been at the forefront of all parties' election campaigns. However, again, you've got to fund what's there. We don't have to reinvent the wheel. We have over 5,000 dental offices in Ontario that want to treat everyone.
Well, and you've got one of them, Dr. Visconti.
I do.
You practice in Timmins.
I do.
Are you on your own or with a group or what?
No, I'm a solo practitioner.
Sole practitioner. Yeah,
Yes.
the PC leader, Doug Ford, was up in your neck of the woods not
He
too long
was,
ago.
and I had opportunity to meet with him.
What'd you tell him?
I told him, well, I introduced myself, and I said, there are, at the time, this was 2 weeks ago, I believe, so they hadn't come out with their announcement
Right,
that they
it
did
just
just
came out
yesterday.
yesterday, right.
And so maybe in some small way, we put the bug in his ear for dental, access to dental care. Mind you, he's talking about seniors, but
You put the bug in his ear, and what did he say?
he said, no, he was very receptive. He was very receptive to the idea about having a meeting and talking about this. And so again, and then he came out yesterday and with his announcement about caring for seniors. And we think that's great.
Okay, but that's only seniors. The others have got children covered as well. Do you think the PC platform ought to be covering children as well?
I think that any government,
And everybody for that matter.
any government, and the province in general, needs to look after the existing programs because we have coverage for children. We have coverage for low-income adults and adults with disabilities. Once these programs are sustainably and properly funded, they're already up and running.
Well,
then we can move towards other programs. And my goal is to be at the table with them, just to talk about these programs.
Can I get, though, how I mean, if you were designing the system here that you think would best cover the largest number of people for the most efficient price, would you get rid of all of the existing programs that we have, create one new universal program, just have it adequately funded?
I think what we already have is a good starting place, We just have to fund it properly and give it a chance.
Okay, but the current programs that we have only fund people on welfare, people on disability, and kids from low income. That leaves out a whole lot of other people.
But once we get those programs properly funded, then we can go from there to say, okay, next, low-income adults, low-income seniors. You have to start somewhere, and we already have programs up and running that require adequate funding and sustainable funding.
I don't think they're going to do that, though. I mean, most of the parties here are talking about new programs, because, of course, they want something new to tell the electorate in an election campaign. New programs. How concerned are you that whatever new programs they introduce are not going to be fully funded, since the previous programs they've introduced are not fully funded?
Well, again, if they can't make a commitment to the existing programs and funding them properly, what's the commitment going to be going forward?
So is your concern that dentists are going to be, again, paying out of their own pockets for a lot of these services that the government is going to be mandating that they provide?
It's a very real possibility, since we're seeing it now.
Okay, so finally, I've hit it on the head here. This is the concern, is that the government is going to put in place a mandate that you dentists provide this service, but they're not going to fully pay you for the cost of the service. Is that the concern?
No, that's not the concern.
Okay.
The concern really is, again, we have the infrastructure. If the commitment is not there, we cannot move forward with a new program, because we need to be able to fund these programs. Again, there's no commitment. So what?
Who should fund it?
Well, I'll give you an example. Right now, the taxpayers are currently covering $38 million for emergency room visits and physician visits for dental-related issues. And although our medical colleagues are doing their best to treat these people, only a dentist can treat and diagnose and treat dental disease. So right now, when they go to the emergency room or the physician's office, they are receiving an antibiotic and a painkiller. That is not treating the
Not
disease.
optimal treatment, right?
It's not treating the disease. And when you think about 38 million covering off a painkiller and an antibiotic and not actually dealing with the problem, what's the chance of reoccurrence of the disease? And then we get into a situation where it's not just financial. You've got needless pain and suffering. You've got children missing school.
But should we socialize the whole dentistry industry the way we have? Socialize is a pejorative word, but you know what I'm saying. We've got OHIP now, where we have a single-payer system for our healthcare system. Should we do that for dentistry as well?
I feel that we should just we should be starting to fund, the starting point would be to fund what we already have.
So I'm taking that as a no. You don't want to be kind of Dentacare the way that Medicare treats hospital visits, doctor visits, all that.
We would be happy to be sitting at the table. And this is another thing, is to be able to partner with the province to be in consultation on whatever they, going forward. Because certain things evolve. I mean, we start with these programs, but again, my concern, without, hammering that back home, is they're not committing to the current programs. What's the commitment to and the funding to the other programs? It's easy to say what you're going to do.
I believe the expression you're looking for is the devil is in the details.
The devil is in the details.
Yes, it is.
That's right.
We will stay tuned. That's LouAnne Visconti. She's the president of the Ontario Dental Association. We wish a safe trip back to Timmins, and we thank you for coming all the way down to appear on the agenda tonight. Thank you
so much.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.